Every 20 seconds, someone in the world loses a limb to diabetes. Most of those people had warning signs in their feet, months or even years before it happened. Here's the thing. Your feet are like a dashboard, and right now, they might be trying to tell you something. There's one sign on this list, sign number 6, that most people completely mistake for normal aging. Doctors call it the silent red flag. I'll show you exactly what to look for. Stay with me to the end, because I'm also going to give you a simple 2-minute at-home foot check you can do tonight. This video draws on peer-reviewed research, ADA clinical guidelines, and input from podiatrists and endocrinologists. I've broken everything down so you don't need a medical degree, just the next 15 minutes. Here's what you're going to learn today. Number 1. 9-foot warning signs linked to diabetes, ranked by severity. Number 2. The science behind why diabetes shows up in your feet first. Number 3. The number 1 mistake people make when they notice these signs. Number 4. What to do this week if you spot any of these. And number 5. The quick 2-minute home foot check. Stay for that one. Let's get into it. Sign number 1. Cold feet, not related to room temperature. What it is: a persistent cold sensation in one or both feet, even when the rest of your body feels warm. Why it matters. High blood sugar over time damages the small blood vessels that supply your extremities. Less blood flow means less heat delivered to the feet. This is called peripheral arterial disease, and the feet are often the first place it shows up. Common mistake. Most people chalk this up to sitting too long or poor posture, and sometimes it is. But if you notice one foot is consistently colder than the other, especially at rest, that's different. What to do this week. Press both palms against the soles of both feet at the same time. Any consistent difference in temperature between them is worth noting. Write it down and mention it at your next appointment. Sign number 2. Color changes in the skin. Red, blue, or pale patches. What it is: your feet appear reddish when hanging down, and pale or even bluish when you elevate them. Why it matters. Healthy blood vessels push blood up and down efficiently. When vascular damage sets in, blood pools abnormally in a dependent position and drains away too quickly when elevated. This position-dependent color shift is a classic sign that perfusion, blood delivery, is compromised. Common mistake. That's just how my skin looks. Color changes that shift with body position are not a normal skin variation. They're vascular. What to do this week. Sit down. Let your feet hang for 2 minutes. Take a photo. Then, lie back and elevate your feet above heart level for 2 minutes. Take another photo. Show both to your doctor. Sign number 3. Wounds or cuts that heal slowly or seem to stall. What it is: a small cut, blister, or scrape on your foot that hasn't closed within 2 weeks. Why it matters. High blood glucose does 2 damaging things simultaneously. First, it weakens white blood cell activity, so your immune response is slower. Second, it disrupts collagen synthesis, the process your body uses to rebuild skin. A wound that should close in days can linger for weeks, then get infected, then become an ulcer. This is how most diabetic foot amputations begin. Quick question: how fast does a normal cut on your hand usually heal? Keep that in mind as a reference. Common mistake: keeping socks on and hoping for the best. If you're not looking, you don't know what's happening. What to do this week. Every evening, remove your socks and check the entire sole of each foot, including between the toes. If a wound hasn't improved in 10 days, don't wait. Get it seen. Which of these first 3 have you noticed before? Drop it in the comments. You might actually help someone else watching this. Sign number 4. Tingling or pins and needles. Not from sitting in the wrong position. What it is: a persistent tingling sensation in the toes or front of the foot that isn't related to how you're sitting or how long you've been still. Why it matters. This is often the first sign of peripheral neuropathy, nerve damage caused by chronically elevated blood sugar. The nerves in the feet and lower legs are the longest in the body, and they're the most vulnerable to glucose-related damage. When they start to degrade, they misfire. That misfiring feels like tingling. Common mistake. I just need better shoes. Footwear doesn't cause bilateral tingling, tingling in both feet at the same time. That's a systemic signal. What to do this week? Note the time of day it happens. Does it occur first thing in the morning? Does it persist past 10 minutes? Morning tingling that doesn't resolve with movement is worth flagging at your next appointment. Sign number 5. Burning sensation, especially at night. What it is? A burning, hot feeling in the feet, often worse when you're lying in bed or resting. Why it matters. As neuropathy progresses from tingling to more persistent nerve disruption, the pain quality often shifts to burning. It worsens at night because there's no movement or distraction. The nervous system's misfiring becomes the loudest signal in the room. Common mistake. Taking over-the-counter pain relief nightly without investigating why the pain is happening. You're treating the alarm without looking at what triggered it. What to do this week? Start tracking it. Use your phone's Notes app. Date, time, intensity on a scale of 1 to 10. Give your doctor genuinely useful diagnostic data. Now, this is the one I mentioned at the start. Pay attention. Sign number 6. Numbness. Losing sensation without any pain. What it is. You can't feel light touch, temperature changes, or even a small object pressing into the sole of your foot. Why it matters. This is advanced peripheral neuropathy. The nerves have gone from misfiring, which gives you tingling and burning, to barely firing at all. And here's what makes this the silent red flag. No pain means no warning system. You can develop a wound, a blister, a deep tissue injury, and have no idea it's happening. This is the stage where people walk on broken bones without knowing it. Common mistake. Thinking, my feet feel fine, means everything is fine. With numbness, the absence of sensation is the problem. The monofilament test. Press a thin piece of fishing line, or even a straightened paper clip, lightly against the sole of your foot near the ball of the foot. You should feel it clearly. If you can't feel it stently, that's an urgent sign. Not schedule it when convenient. Urgent. Sign number 7. Thick, discolored, or brittle toenails. What it is. Nails that are yellowish, thickened, crumbling, especially the big toenail. Why it matters. Reduced blood flow creates a low-oxygen, high-glucose environment at the nail bed. Fungal organisms, dermatophytes, thrive in exactly these conditions. Recurring fungal nail infections in adults over 40 are not just a cosmetic issue. Myth versus truth here. Many people think thick nails just happen with age. True, nails do change with age, but recurring fungal infections, the kind that keep coming back despite treatment, are a different pattern. That pattern warrants investigation. Common mistake. Treating only with antifungal cream without ever testing blood sugar. The infection keeps coming back because the underlying environment hasn't changed. What to do this week? If you've had 2 or more fungal nail infections in the past year, ask your GP for an HbA1c test alongside any antifungal treatment. These 2 things can and should happen at the same time. Sign number 8. Severely dry, cracked skin on the heels. What it is? Deep cracks in the heel skin. Not just seasonal dryness, but splits that hurt, bleed, or stay cracked regardless of how much moisturizer you use. Why it matters? There's a branch of the nervous system called the autonomic nervous system that controls sweat glands. Diabetes-related autonomic neuropathy disrupts those sweat glands in the feet, so the skin can't self-moisturize from the inside. No internal moisture means the skin dries out from within, becoming thick and brittle, and eventually cracking under normal walking pressure. Common mistake. Treating it as a hydration problem. Just drink more water, use more lotion. If the autonomic nerves aren't working, no amount of external moisturizer fixes the root cause. What to do this week? Urea-based cream, 25 to 40% concentration, is the most effective topical option for autonomic dry heel skin. But if your heels crack every season regardless of climate, that's a consistent pattern worth mentioning to a doctor, not just a dermatologist. 2 more signs to go. And number 9 is the one that sends people to the emergency room thinking they've sprained their ankle. Sign number 9. Changes in foot shape. collapse, swelling, asymmetry. What it is: one foot appears to have a collapsed arch, or a rounder bottom profile, or it looks structurally different from the other foot, often with painless swelling. Why it matters. This is called Charcot arthropathy, Charcot foot. When neuropathy is severe enough that you can't feel pain signals, bones and joints can fracture and dislocate under normal walking stress without triggering the protective reflexes that would normally stop you. The foot literally remodels itself from the inside, without your awareness. Common mistake: assuming it's a sprain or minor swelling. A sprain has a cause: a twist, a fall. Painless swelling with shape change and no injury mechanism is a different thing entirely. What to do this week? Look at both feet side by side, from the front and from the side. If one looks structurally different from the other, different arch height, different profile, that warrants an urgent podiatrist appointment. Not a GP referral, podiatrist, directly. Let's recap the 9 signs quickly. Sign 1. Cold feet not explained by posture or temperature. Sign 2. Color changes in the skin that shift with position. Sign 3. Wounds that stall after 10 to 14 days. Sign 4. Tingling or pins and needles unrelated to posture. Sign 5. Burning sensation, worse at night. Sign 6. Numbness, the silent red flag. Sign 7. Thick, recurring fungal nail infections. Sign 8. Severely dry, cracked heels that don't respond to moisturizer. Sign 9. Shape changes in the foot, especially painless. The key rule? Any 2 of these together, especially if you're over 40, means see a doctor this week, not next month. Here's your action for today. It's just one thing. Tonight, take your socks off, sit down, and spend 2 minutes looking at your feet, both of them. Check the soles. Check between the toes. Run your hand along the heel. Press on the ball of the foot and check if you can feel it. That's it. 2 minutes. It costs nothing. If you spotted something in this video that you've been ignoring, save this video. Go back to the sign that applies to you. Show it to someone you care about. Subscribe so you get it the day it drops. Tell me in the comments, before today, did you know your feet could show diabetes symptoms? Most people don't, and most wish they'd known sooner. See you next week.